This video will look at traction manipulations in the thoracic spine. Let me define traction for this purpose. Dictionary-wise, traction is a pulling force, but it doesn't help us very much. If we apply traction to the arm, it could be that we're pulling the arm downwards by the side of the body, or we could be pulling it outwards via the neck of the humerus, or we could be pulling it forwards. All of those would be traction, but they don't tell us anything about what we're actually doing to the joint. I'm going to redefine traction for our purposes as traction is a force that tends to produce distraction. So for the shoulder, for example, there is only one direction for traction, and that's pulling along the neck of the humerus. That is a mechanical axis to distract the humerus from the glenoid. That's why I'm using the term here. So we're going to look at various ways of producing traction in the spine. This will tend to, most of these will give you distraction along the line of the spine, separating the end plates from each other, or tending to separate the end plates from each other. There's also another traction manipulation there which tends to produce distraction of the facet joint. And this is a posterior thrust for both facets at the same time. I'm also adding another technique that requires traction, longitudinal traction, to perform the technique properly. So in all, there are, I think, 1, 2, 3, 4, 5 techniques, I believe. We'll find out.
And lift the superior vertebra away from it. The stabilization needs to go on your costochondrium, so the bed height is adjusted to you. Don't put this on there and then try to adjust yourself to the bed height. It gets more difficult. So this is generally used for the higher levels or smaller patients, because all of the thrust is done with your hands. So with that, simply that pushes against them there, and that will fix the bottom one. So hands up once across your arms, that way, and you grab the bottom elbow. Move, head back so you don't smack you in the face when you do the thrust. And you just lean back, and that puts the stress through the whole system and stabilizes it there. Squeeze your arms into the inferior scapular area, and then you're going to retract and elevate your shoulder girdle. That. Okay. Now we're going to do a different type of traction for a heavier patient or lower down, and we'll fix the superior vertebra now and drop the inferior vertebra away from it. So again, it comes onto there, fix them that way. The arms come across their chest without crossing over each other. Grab the bottom elbow again, head back and lean back. Now this is completely different. The arm stays still and you fix her body, and you simply rock back to get some momentum. And then on one of these, you'll go up on your back toes, like so. So he's back, lifting and catching them so they don't hit the bed. Is supine, so we're basically going to fix the same vertebra. So if I'm doing T4-5, this will fix 4, and this will be on 4 as well. So they're both there, sorry, on 5, and then we'll thrust up, taking 4 away from 5. So they're on the same level now. Push down to stabilize the inferior vertebra, and all you can do is lunge up the bed. So again, there, fix, and thrust. Okay, next manipulation is for a segment basically that's subluxed to the right, and what we're going to do is take it to the left. It means we've got to put a lot of traction on this, push down to get good stability of the inferior bone, traction up to separate them, and then we're going to thrust across the body that way. So roll and lift there, push down, traction up and thrust. Okay. Roll and lift, push down, traction up and thrust. So if I take that away, the thrust basically is that. The sideways thrust is across the body.
this technique to correct a transverse subluxation. You need to be careful when you're practicing it. It's possible to do some damage while you practice. It's okay if you're doing it because there's a dysfunction present. But if you're just practicing this on people, if they're at all weak in this direction, you can certainly thrust them across and produce problems. My suggestion is when you practice the thrust, you do the traction, you can push back downwards, do the long traction, but when you actually do the lateral thrust, just let the locking hand collapse. So your hand's in that position, you're grasping across the ring here. So you've got the ribs on each side of your hand, lumbrical grip. And as you do the thrust, that way you just let the hand open. So there's no stabilization. Otherwise, don't practice this full on with your partner.
Distraction. So we're going to separate the facets on both sides simply by pushing down. So the stabilization is the same as we just did for the long traction, stabilizing the same inferior vertebra, and then we'll push downwards to gain the movement of posterior movement of the superior. So roll and lift on, and basically stabilize those two, and I'm just simply going to push straight down. Right there, and